film aims to give you information about the various methods of contraception available, to help you plan your pregnancies, and to protect you against sexually transmitted infections, otherwise known as STIs. We asked some people on the streets of Nairobi in Kenya what contraception meant to them.
I think contraceptives are methods and measures people take to prevent pregnancies.
You can prevent yourself from some diseases like AIDS, STIs.
One may have a plan, and a plan of having the number of children in the family.
What questions were there for sexual health expert Dr. Suman?
What are STIs?
STIs are infections that are passed on through having sexual intercourse. Usually you can't actually tell whether someone's got an STI or HIV, but some of the symptoms that people experience are a change in their discharge, sores on the genital region or lumps and bumps in that region, or pain when you pass urine or wee. Most STIs can be easily and cheaply cured by a quick visit to a local clinic, but many people don't realise that and can suffer in silence for a very long time. Best way to prevent STIs is through using a condom.
Why is contraception useful?
Having babies before the age of 17 can put women at much greater risk of complications in pregnancy and childbirth, or even of going on to lose the baby or to die during childbirth. Women's bodies need time to recover between pregnancies. And also women who have more than 4 children are more likely to experience bleeding and other problems in childbirth and even death. Using contraception can help prevent against these problems. Sometimes people worry that knowing more about contraception might encourage people to have more sex and to have sex earlier, but we know that this helps people to make safer and more careful choices.
What other questions were there for Dr. Suman about contraception and getting pregnant?
Is contraception the man or the woman's decision?
My husband does not want to use contraception. What can I do to avoid getting pregnant?
Will contraception make me infertile?
Will contraception be dangerous for my health?
Is it true that if you urinate after having sex, you won't get pregnant?
Can magic stop you getting pregnant?
It's certainly not true that magic or urinating after sex can prevent pregnancy. To answer the other questions and explain how contraception works, Dr. Suman went to meet a group of young people in the United Kingdom.
Today we're going to talk mainly about contraception, so how you prevent yourself having a baby, but it's good to think about how to protect yourself against sexually transmitted infections and HIV as well. We're going to start off by talking about condoms because that's really the only method that does both. It's important to check that you've got a new condom every time you have sex. They're made of rubber and they go on the erect penis just before someone's going to have sex. So you can see there's this little bit at the end that you squeeze the air out of. Okay, so you can see that when this is on the penis, it actually stops the sperm going into the vagina. The sperm's actually caught in the condom as it comes out.
Do you have to have the condom on during the whole period of sex?
That's a really good question. It's really important that it goes on before sex starts and stays on the whole time through. And you may know that sometimes a little bit of sperm can escape from the penis before ejaculation actually happens. And of course, it's important that at the end of sex, when you take them off, that you carefully remove them and dispose of them so you don't spill any of the sperm inside. So all these other methods of contraception do prevent against pregnancy, but don't prevent against sexually transmitted infections or HIV. But the thing about them is that when you use them and then you stop using them, you'll return to being fertile and able to get pregnant again at the end of it. Does anyone know what this is?
Is it the coil?
Good, okay. Do you want to have a look at it? So it's put inside the womb by a doctor or a nurse who's specially trained, and then it sits where a baby would normally develop. It sits in the same place.
Does it hurt your body to use the coil?
No, these are very, very safe. They're used by lots and lots of women worldwide. But once it's in, you shouldn't know it's there. This is an implant, and again, it needs to be put in by a doctor or a nurse. You'd go to your local clinic, and it would be put into the inside of the arm, just under the skin, so it's tucked away actually, and you won't know it's there. Like the coil, you can't see it, and you can easily forget about it, and it can stay there for 3 years. And what it does is stop the ovary releasing eggs, so you can't get pregnant.
Are there any side effects from putting an implant in your arm?
It's very, very safe, so it doesn't cause women long-term health problems, but women do experience a change in their periods. It's perfectly safe, but some women just don't like it. The next method we're going to talk about is the injection. Like any injection, it can go in your arm or in your bottom, and you need to have it every 3 months. And it works very, very well. And they do the same as lots of these different methods, which is stopping the ovary